Hi, welcome back everyone. I'm Michael S. Horney. I'm a chiropractor. I've been doing this for close to 40 years now. I'm also certified in clinical hypnosis, in personal training, and nutrition and weight loss. I'm at, what's the name of this studio again, Tina? I have to get Tina involved.
Mindful Movement Pilates.
Mindful Movement Pilates in Porch. Yeah, these are my go-to people. Tina, okay, who you'll see when you come visit the studio, and Courtney, who's demonstrating the exercises. Okay, what we're going to do right now, we're going to continue with our series. This is a Gluteus Maximus strengthening exercise, Maximus strengthening, so that's your butt, that's your glutes, okay? So Courtney, she's going to demonstrate this. While lying on your stomach, you're going to raise the right leg off the floor by keeping the knee straight. Turn the foot outward while lifting the leg. Hold the leg up in this position for a count of 4 and slowly let it down. Now you repeat this 6 times, and remember what I said before, it could be 6 times, 10 times, 3 times. The important thing is you do this and you do it with really good technique. Then you repeat the same exercise with the opposite leg, and then, so you're going to bring it up, the foot is turned out, okay, you're going to hold it, let's say for a count of 4, and then you're going to slowly bring it down. And when you bring this leg up, you want to really feel the tightness in your butt. And remember what we talked on all the former programs, when you exert yourself on the exertion phase of an exercise, you're always exhaling and you're tightening your abdominal muscles, okay? You're bracing your abdomen, actually, the core muscle. So you're accomplishing multiple things at the same time. Very often in patients I find there's a weakness of your glute muscle. So this is a very important exercise relative to the muscles that do this, the psoas muscle. How many people have heard of the psoas before? How many people know that the psoas muscle, okay, is filet mignon? All you meat eaters out there, that's when you have filet mignon, that's what you're eating. You're eating the psoas muscle. The psoas muscle is a very strong muscle. It's a hip flexor muscle. How often do you sit during the day? How often do you drive during the day? So it's always contracted. So most people have a real discrepancy between the strength of the psoas and the glutes. And when there's an imbalance, that can lead to a lot of issues, particularly low back pain. So this is a very important exercise. Okay, now the next one we're going to do is a low back strengthening. So that's this whole exercise here. And it's the same thing. We're sitting, we're flexed all day long typically. So what happens, this muscle gets weaker than the abdominal muscle. So everyone, there was this craze with, you got to strengthen your abdominal muscles. No, you got to strengthen all of the muscles, particularly your back extensor muscle. So what you're going to do, and again, with this, if you have any issues, for instance, spinal stenosis, okay, any type of issues, you want to make sure that you can do this, and if you're seeing a chiropractor or a physician, that they're okaying it. What I really like about Tina and Courtney is they're very aware of these conditions. So when you come in, they're giving you forms to know if you have any medical issues. And if you have any medical issues, they know certain exercises, they're not going to do that with you. And if they have any questions, they're going to have you call your doctor, or you can call me. But I really appreciate the extent of the training that they have. You're in very safe hands, and they're very thorough. Okay, so this low back strengthening. So you're lying flat on your stomach with your arms along the side. Courtney has her palms up. Some people will have palms down. It's whatever your preference is. Okay, you're going to slowly raise your chest from the floor. And again, you're exhaling, you're engaging your abdomen. Feel the muscles of the low back tighten. And you hold the chest up from the floor for a slow count of 4, and then you slowly let it down. So it's all these muscles in here that you're strengthening. And whether you do it for a series of 6 of them, or 10 of them, or 3 of them, the main thing is you're doing it with really good form, you're strengthening these muscles, and that's going to go a long way in terms of helping you maintain a very healthy spine. Thank you, Courtney.
Maybe
I appreciate
Courtney
it.
can demonstrate that on the Cadillac by grabbing that bar in front of you.
Great.
Yeah. So just grab the bar in front of you and just bring your head down so your nose is hovering over the mat, straight neck. Take an inhale, lifting the navel up towards the spine, pressing your pubic bone and hip bones down, and come up, drop your shoulders. Now exhale as you slowly roll down through the rib cage and down towards the chest. Take a deep breath as you press your hands in, pull your arms, and slowly rise up, watching the neck, and then slowly rolling down.
That's perfect. You know, that's why all of these exercises, I'll actually give you this sheet when you're a patient in my office, and I'll go over all of these exercises, but there's nothing, okay, that can basically take the place of coming to a studio like this where people have a lot of knowledge, they're thoroughly trained, they're going to demonstrate how the exercise is done, they're going to watch you do it, they're going to supervise you, they're going to tweak it where you need to tweak it, and that by far is the most thorough way to do it. Okay, we're going to do another exercise. Well, you know what, let's go to the next segment because enough of me already, okay? Go for it.